Ever pondered on the thin line between cure and catastrophe when it comes to the prescription of medicine? The issue of overprescribing and underprescribing drugs is a global concern that presents a complex conundrum teetering on the delicate balance of health and harm. Consider the tale of Mr. Johnson, a middle-aged man from a small town who was diagnosed with high blood pressure. His doctor, with the best intentions, wrote him a prescription for a blood pressure medication. However, the dosage was too high for Mr. Johnson's condition. As a result, he experienced severe side effects, including fainting spells and kidney problems. The overprescription turned his remedy into a health risk. On the flip side, take the example of Mrs. Adams, a young woman suffering from chronic migraines. Her doctor, wary of the potential for drug dependence, underprescribed her pain medication. This led to a diminished quality of life for Mrs. Adams as she struggled daily with uncontrolled pain. The underprescription created a situation where her suffering was unnecessarily prolonged. These stories paint a vivid picture of the consequences of overprescribing and underprescribing. On one hand, overprescribing can lead to harmful side effects and potentially foster drug dependence. On the other, underprescribing can result in unalleviated suffering and a lower quality of life. Navigating this complex issue requires a deep understanding of the patient's unique health circumstances as well as the potential risks and benefits of their prescribed medication. It's a delicate dance, a balance that must be struck with precision and care. To summarize, the issue of overprescribing and underprescribing is a significant concern in the world of medical treatment. It's a balancing act that requires careful consideration of the patient's condition, the potential side effects of the medication, and the risk of drug dependence. The consequences, as seen in the cases of Mr. Johnson and Mrs. Adams, can be severe, impacting both physical health and quality of life. In essence, the prescription of medication is not a one-size-fits-all solution. It requires a personalized approach, a careful balancing act between alleviating symptoms and avoiding harm. It's a conversation that must be had, a dialogue between patient and doctor, to ensure the best possible outcome for each unique individual.